Rebecca. Amazing. And as we gather in spaces together, we encourage you to reflect on your own positionality on these lands and your personal commitments to reconciliation. So I just want to welcome everybody for joining us on this very rainy but much needed rain morning on a Friday here. Thank you for being with us. I am very pleased to be able to introduce our round speakers for today. Dr. Melba D'Souza is an associate professor of nursing and population health at Thompson Rivers University and is a nurse educator, researcher, and practitioner whose leadership in nursing has advanced academic excellence, equity, and engagement in the graduate program. And with an academic background and clinical experience in Canada, Melba bridges the gap between academia and practice by empowering students with evidence-based, compassionate decision-making skills vital for nursing care. Her experience is recognized in values-based, trauma-informed, and culturally competent practices in nursing education. Melba established the Cancer Navigation and Reported Outcomes Project, an initiative addressing the priorities and needs of people diagnosed with breast cancer in rural BC, with a focus on Black, Asian, and minority ethnic peoples. This project influences digital health innovations and culturally sensitive interventions to reduce disparities and inequalities, enhance psychosocial support, and improve quality of life for people living in rural and remote communities. Her implementation science, supported by Breast Cancer Canada and Tri-Council grants, has been published and has informed the development of inclusive, supportive survivorship care models. And Aishwarya Manish holds a Bachelor of Science in Psychology from UBC Okanagan. She will be starting a Master's in Public Health, congratulations, at UBC this September. Her academic and research interests lie at the intersection of community psychology, harm reduction, and public health. She has experience in qualitative and quantitative research methods, including literature reviews, data analysis, and participatory community-based approaches. Currently, she is co-authoring a paper with Dr. D'Souza exploring the psychosocial impact of breast cancer on senior adults residing in interior BC. And apart from her academic pursuits, she likes to paint. She enjoys creating mixed media art that incorporates mirrors, stones, and clay. And her artistic practice serves as both a creative outlet and a form of personal reflection. So with that, I'm thrilled to turn over the floor to Melba and Aishwarya.
Thank you very much, Catherine. And I also like to thank the Women's Health Research Institute at British Columbia Women's and for this research rounds presentation. I had been a part of this for several years, and it's really amazing work that they do. And it's very thoughtful, focused, and beautifully presented by various members. And I hope today Aishwarya and me also can keep it up with our research team. This work that we are presenting today is a work of a larger group, and we too are co-presenting it together, looking at visualizing survivorship care and digital innovations in rural communities in British Columbia. Thompson River University campuses are on the traditional lands of the Tekter Shwepnik and the Teksik within Sepnik Ulu, the traditional and unceded territory of the Shwepnik. The region Thompson River University serves also extends into the territories of the Statlam, Nakals, Nuls, Tisol, Dakil, and Selix. I acknowledge my work here on this traditional unceded lands and welcome everyone to put their own acknowledgement from the lands that you come from. Like Catherine said, I'm Melba D'Souza. I work at Thompson River University, and my program of research includes psychosocial oncology, supportive and early survivorship and digital care. I also work with a wide variety of organizations and associations within Canada and the international world.
Good morning, everyone. I'm Aishwarya. Thanks for the great introduction, Catherine. I completed my Bachelor of Science in Psychology, and I'm an incoming master's student at UBC. I'm currently a graduate research assistant on this research grant.
Today, we want to take you through some of the works that we have done in establishing community partnerships, delivering digital literacy for participants in survivorship, and pilot testing some of the digital innovations for usability in the rural communities in British Columbia. We take you through some of the background work, methods, aims, and recommendations that came up through our pilot study. Cancer is one of the leading causes of mortality for men and women in Canada. And following the cancer diagnosis, access to information resources can improve patients' engagement in care. But most of the time, some of the care treatments that can play a role in addressing patients' challenges throughout their journey uh, is basically informed by their expectations and some of the unexpected deterioration in physical, psychological, social, and emotional well-being. Among them, breast cancer accounts for approximately 25% of new cases of cancer and 14% of all cancer deaths. If you look at the statistics, Canadian Cancer Society estimated that breast cancer would account for one quarter, 25% of all cancer cases in females in 2024. So cancer does impose a substantial burden on the Canadian society, with different variety of cancers accounting for nearly 48% of all cases. In British Columbia alone, 26,735 new cancer cases were reported in 2018, with an incidence rate of 533 per 100,000 of populations of people. And hence, information about the illness can increase a person's confidence and their ability to cope with the effects of the illness in their own home. Basically, people do rely on health professionals and materials to help them build information they need across the time in their cancer journey. And some of the several studies have looked at different metrics evaluating patient navigation programs, and some of them look at timeliness of care, treatment adherence, benefits of the professional navigation, including symptom management and equitable access of cancer care in rural and remote communities. Notably, some of these informations have limitations and they also affect the usability and accessibility to the resources. Hence, sometimes people hesitate to ask and raise questions. 17% of our population resides in rural and remote communities of British Columbia. And some of these communities, rural and remote, do not have established cancer supportive navigation and survivorship programs and services in place. So people have to trust and work on online health information as resources are sometimes varying and not reliable. Some of the literature review shows when we explored that there are connections with breast cancer people, especially from socially and economically disadvantaged groups residing in rural communities and the challenges they face in accessing the resources related to their care outcome. People do face different cancer management strategies along their breast cancer treatment, and information support is vital to increase their confidence and engagement in the care. 24% of the women reported insufficient emotional support during their breast cancer treatment, while 50% felt adequately supported at diagnosis. Notably, 20% of the women desired for more emotional support, especially with reducing symptom severity and distress. And in our systems, it is important to note that supporting people, especially with symptom monitoring, decision supports, health management, and tailoring that based on their user needs is important in the journey of a person.
Understanding digital health. So, what is digital health? Essentially, it's the intersection of technology and healthcare services aimed at enhancing healthcare outcomes. It comes with benefits such as improving health knowledge and self management practices during cancer follow up, but it also has potential challenges, which include technical issues, lack of technology knowledge, and data security, which needs to be addressed. So, the strategic objectives of digital health that have been listed by the World Health Organization include promoting global collaboration and advancing the transfer of knowledge on digital health, advancing the implementation of national digital health strategies, strengthening governance for digital health at global, regional, and national levels, and advocating for people centered health systems that are enabled by digital health. Coming to cancer navigation and digital health. Previous research highlights that caregiver navigators using web based tools can connect patients to social support services and foster meaningful discussions. Online navigator tools are also found to increase satisfaction and reduce anxiety. Additionally, telemedicine-based navigation has proved effective in resource-limited settings. Cancer survivorship and digital navigation. So, building on these benefits, thoughtful implementation of clinical workflows, enhanced provider education, and attention to access barriers for marginalized communities are essential. Prior research suggests that digital health navigators can address these needs by applying practical and regulatory knowledge to support and train oncology teams, overcome barriers, and ensure timely virtual care across all phases of the cancer care journey. So, what do digital navigators do? These are the support areas, which include remote monitoring, engagement and literacy, care coordination and virtual navigation, and psychosocial and emotional support. Now, why do we need cancer care navigation in interior British Columbia? It helps avoid long distance traveling, avoid additional travel and lodging costs, prevent exhaustion, both physical and mental. It's a flexible option to avoid missing work, and it also removes the need to arrange for childcare for those who may need.
Some of the aims of our study were to look at what are the barriers and facilitators of accessing and using cancer care services in British Columbia for people with breast cancer diagnosis, treatment, and post-treatment. And the second was also to look at how effective it was with the employed digital health innovation and cancer navigation in enhancing patient navigation care and also patient-reported outcomes for people living with breast cancer. Overall, the aim was to look at the design to develop a very usable application that provides patients with information that aligns with their particular support needs and preferences using the digital health innovations we created and designed in the research study to ensure that these tools are important and also useful to the users in our study. We used a consolidated framework of implementation research. The core component was creating a user-centered design, and one of the most influential components of this design was having a community participatory action research, where we had assessment strategies to look at the resources available and the capacity and readiness for using the user designs. Second was adapting to the needs of the rural context and the communities that they live in and the people who are going to use this design and tailor to their needs. The third was looking at capacity building interventions, especially learnability, errors, and effectiveness of using the design and how these informations can be recommended and identify issues that are taking place during the user need and obtaining information that is important during the time before the innovation began. The second part was to look at the different structures of implementation. So creating an implementation plan and also developing this implementation plan with using the digital health innovations with trust from trustable resources and also adapting it over time in the cancer journey in the person in the research study. And the third was the ongoing implementation and testing out this trial with the information needs of the population and technical assistance for developing the digital health innovations based on the changing needs of the breast cancer people, process evaluation, and using supportive feedbacks in place to overcome challenges and prepare for changes in the study. And the last was learning from the experience of this digital health innovations. So we used an implementation science research model and a mixed methods research approach. We used a randomized control trial and open cohort with a parallel group for treatment adherence in the intervention group with the digital health innovations using stratified block randomization. So our mixed methods approach entailed a pilot study using professional navigation in 2022 to 2023. And then now the final study and the intervention of it is ongoing and soon to be completed. And these are some of the data measurement instruments we used with cost facet intervention tool and a functional assessment for cancer therapy, breast cancer navigation survey, participant satisfaction with navigation scale, satisfaction with interpersonal relationships, and breast cancer navigation interview. The design of the randomized control consisted of a recruitment and screening phase, enrolling the participants and then randomizing them to the intervention group for digital health innovations and a control group for standard of care. And a randomization also to look at the quality of the navigator efforts and the outcome impacts, and using the data measurement instruments that we had created in the study. So the trial flow design included an enrollment where we had around 148 people here who were eligible and informed consent, and ineligible were 20. And we assessed and randomized them, 138 people allocated to the digital health innovations and standard group. We had 69 in each group. And follow-up assessment at the end of 3 months, we had at the end 54 people. So we analyzed data of 54 people in the intervention group and 54 people in the control group. Some of the sites that we used in the study were 100 Mile House, Revelstoke, Kamloops, Kelowna, Merritt, Penticton, the rural and remote communities surrounding these areas. Inclusion criteria included 19 years and older, people who are able to read and write in English and other languages, diagnosis of breast cancer at any stage, eligible for treatment and different therapies in breast cancer. Exclusion criteria included very advanced breast cancer with metastasis, secondary cancer, and people less than 19 years.
Here's the digital health innovations model that we created to address psychosocial issues faced by patients. The model shows digital innovations that have been developed to address these psychosocial issues. These digital innovations include cancer care education, cancer care navigation, the Breast Cancer Navigator app, and Cancer Care Innovation Lab. Today, we will be elaborating on cancer care education, cancer care navigation, and the breast cancer app. So, what is cancer care education? It was essentially created to help breast cancer patients navigate their cancer care journey. It consists of interactive videos, quizzes, and assessments, which transform content into engaging and personalized learning experiences. The cancer care education um, modules have 5 learning objectives mentioned, which are essentially aimed to deepen understanding of cancer's psychosocial, psychological, emotional, spiritual, and quality of life impact. Additionally, it aims to discuss the lack of health literacy in social contexts through a culturally sensitive lens. These are the 11 modules that are designed to offer comprehensive understanding of cancer. The first 6 over here and the next 5. So, the first module is Understanding Breast Cancer. This section provides an overview of the breast cancer care pathway. It talks about early detection and personalized treatment approaches. The breast cancer treatment section highlights information on treatment decision making, stages of cancer, and other supportive therapies. This section covers 4 key areas, which include returning to work, physical activity and exercise, nutrition, and prosthetics. The lymphedema section discusses why it develops, how it's identified, and how to manage it effectively. This section focuses on strategies to help individuals manage the physical, emotional, psychosocial impacts of breast cancer treatment. It highlights holistic services such as nutritional counseling, massage, acupuncture, and spiritual care. The What Happens Now section guides patients through the transition to survivorship after completing their treatment. This section addresses the range of emotions that individuals face during the healing journey. Um, This section addresses the unique challenges faced by diverse communities in accessing and navigating breast cancer care. Healthy living focuses on strategies to maintain overall well being during the transition from active treatment to survivorship. The family and support section explores the emotional and practical challenges families face when a loved one is diagnosed with breast cancer. It includes practical tips for providing physical care, emotional support, and navigating healthcare systems. Section 11 focuses on preparing individuals and families for future healthcare decisions. Appendix 1 is Community Locators, which offers a comprehensive directory of local services and supports across British Columbia, particularly in the interior regions. It highlights physical and mental health resources, screening programs, survivorship and support groups, and many more. Cancer care navigation is the second innovation, digital innovation. It serves as a bridge between patients, caregivers, healthcare providers, and an array of services and resources available throughout the cancer journey. It is essential for navigators, healthcare providers, and caregivers um, to meet the needs of patients where they are at. Cancer care navigation aims to train professional navigators to efficiently do so. These are the goals and aims of the module. The objectives of cancer survivorship and navigation in British Columbia are to understand implementation factors affecting its use, assess its role in capacity building, mentoring, and support. It aims to enhance quality of life through connection and resource sharing. This is an overview of the Cancer Care Navigation module contents. There are 7 knowledge hubs. Next slide, please. Yeah, thank you. Knowledge Hub 1 describes the goals of navigation and survivorship. Knowledge Hub 2 deals with understanding learning preferences to educate people through a patient-centered approach. This section deals with understanding symptom assessment and utilizing tools to do so using the BC Cancer Symptom Management Guidelines. Knowledge Hub 4 emphasizes the challenges of health literacy, communication, and education. Knowledge Hub 5 aims to understand the psychological distress patients face and how to assess anxiety and depression. This section highlights ways to effectively provide support through a culturally inclusive lens. And lastly, the last section of the web-based education differentiates between different types of psychosocial supports. Okay, now we come to the Breast Cancer Navigator app. It's the third innovation, digital innovation. It's a user-friendly platform to support breast cancer patients in Canada. The key features include AI personalized health plans, symptom and outcome trackers, and the resource hub. The app has 3 main options, which include the CarePath AI, personalized wellness hub, and tailored learning. The CarePath AI features an interactive AI powered chat, allowing users to ask personalized questions about breast cancer in a conversational format. The personalized wellness hub creates personalized plans by taking into account key personal details such as age, gender, dietary preferences, or restrictions and current physical activity levels. It offers guidance on three aspects: nutrition, exercise, mind and wellness, as you can see on the screen on the right. In the nutrition and meal plan specifically, it includes tailored dietary guidance, nutritional details, and caloric information. The exercise and mobility plan includes adaptive fitness strategies, structured exercise guidance, and practical tips. And the mind and wellness plan includes emotional support tools, well being practices, and social connection tips. Now, coming to the third main option of the Navigator app, it's tailored learning. It offers individuals access to comprehensive educational resources based on four main topics: types of cancer treatments, patient and survivor journey mapping, managing post chemotherapy, and post radiation symptoms. This section provides treatment options for 5 treatments from surgery, radiation therapy, chemotherapy, hormone therapy, and immunotherapy. The patient and survivor journey mapping section includes resources for emotional and physical challenges, post treatment follow up, survivorship and rehabilitation, and long term care. This section includes the following for managing common side effects. It goes from nausea to gastrointestinal symptoms. And the post radiation, managing post radiation symptom section includes resources for managing these 6 symptoms following radiation therapy.
The results from this study show that in the age group, we had 40 to 49 years people, 31% in the intervention group compared to 22% in the control group. And for people, we found that in the black, there were around 16% of people in the intervention group compared to 14% in the control group. And for the education, we found that 33% of the people were college educated compared to 37% in the control group. Looking at the other characteristics for work, we found that 22 people percentage had social benefits in the intervention group compared to 14% in the control group. 81% of the people lived in the rural communities compared to 55% in the control group. And we had 66 people who used smartphone less than 10 years compared to 72% who used them in the control group. Looking at the user design and the study, it shows usability, feasibility, satisfaction, and acceptability of the use of cancer care navigation, cancer care education, and the mobile apps, the use and the simplicity to use it, the feasibility, acceptability, and the value of this reported by participants in the intervention group with their professional and digital health navigators. They showed satisfaction with usability. 48% of the people said they were able to connect with the professional navigation without difficulty. 42% of the people said they were able to meet with the research coordinator, which showed promise. And 42% of the people said that this contributed to their self-satisfaction and quality of life in response to their concerns. 40.7% of the people said that this user app contributed to their personal well-being and increased their satisfaction and improvement in their well-being and opportunity with self-education, and also with learning about the existing resources and access to different resources in their breast cancer journey. Distribution of the functional assessment of cancer therapy and breast cancer scores between at baseline, post 3 months, and post 6 months between the intervention and control group tested with ANOVA repeated measures. We found that at the baseline, it was significantly associated emotional well-being between intervention group and the control group, with a mean of 20 in the intervention group and 13 in the control group. The results also indicated at post 3 months, it showed that social family well-being, social emotional well-being, and breast cancer scale were significantly associated between the intervention group, a mean of 23, 19, and 22 respectively, compared to the control group who had mean of 22, 16, and 21 for the breast cancer scale. These findings also at the end of 6 months remained the same. We had an increase of value for physical, social, emotional, and for breast cancer scale for the means of 24, 24, 21, and 25 for the intervention group compared to the control group of 19, 22, 17, and 24. Some of the qualitative findings showed that the determination of the people with regard to their own journey and enhancing their journey, they mentioned that for medical support, they would have to learn and understand the diagnosis, the treatment options, and managing symptoms and pay care and follow-up in their journey. And for emotional and spiritual health supports, they found that having access to counseling, peer support, spiritual, and fear of recurrence and support groups were available to them. Financial support, they found responses that said that with income loss and the most other themes that came up were disability, financial coverage, travel, access to medication and support systems that they received, and mentoring in the best practices in this research study. With physical support, they said that they had access to information about side effects, movement, and the strength and massage that they required in their journey, and resources. For psychosocial and mental health well-being and support, they spoke about their return to work, caregiver supports, navigation, survivorship, and social support that they received. For the findings, when we looked and discussed with other studies, we found there was higher usability, feasibility, and acceptability of professional navigators reported by the participants in the intervention group. And we found gender, education, years of living in Canada, and living residence in rural and remote were significantly associated among participants in the intervention group compared to the control group. And we also found that for quality of life, their social and family, emotional well-being, and the breast cancer scale were significantly associated in the intervention group at 3rd and 6 months compared to the control group. Some of the discussion findings highlight the need for supportive care and survivorship programs in the context of the rural communities, focusing on digital health interventions to leverage the support within the family and community is important, and also increasing facilitators to help and develop and implement digital health that can improve the quality of life and longevity of the people with the resources and access to cancer care services and programs in the communities. There was also emphasis on accessible, user-friendly digital materials in the study with clear, purposeful, and content-rich graphics and videos. Enhancing participant engagement in navigation with professional navigators is one of the significant aspects that came up in the study. Recommendations based on the study: there need to be an ongoing evaluation of factors contributing to increase in professional navigation and the impact on informed choices. There should be further implementation science for determining efficiency and efficacy of digital health innovations to improve the quality of life. They should be developing competencies for navigation, supportive, and survivorship in nursing and health science curriculum. They have to be integrating standards of care and scope of practice for navigation, supportive, and survivorship care through professional organizations, and also creating knowledge sharing summits to discuss the recommendations and initiating dialogues about key messages with senior leadership. To conclude from the study, for the activities in navigation, digital, and survivorship, professional navigators shifted the culture of communication with the participants to increase culturally relevant and person-centered care to the participants. Digital health innovations focused on developing skills for increasing the motivation and commitment in the long term. There was efficiency of professional navigation through the digital health tools for symptom tracking with mobile health, web-based, and digital health tools to create a person-centered, supportive, and survivorship model. There is developed integrated knowledge translation that we developed, such as infographics, posters, reports, and publications for knowledge dissemination in the community. These are some of the references that we used in the study. And this is our funding thanks to Breast Cancer Canada and CHR Planning and Dissemination Grant. And we declare no conflict of interest. This funded grant was created for research purposes by project researchers, community partners, advisory board from British Columbia. Our partnerships and collaborations include BC Cancer, Thompson River University School of Nursing, UBC, the Population Health Aging Rural Research Center, Kamloops Cancer Supportive Care Society, Inspire Health Supportive Cancer Care, Interior Health, Canadian Mental Health Association, Kamloops Immigrant Services and Refugees, Spirit Warriors Dragon Boat, and the Kamloops Breast Cancer Support Group. So we are open to discussion, questions, and feedback from the audience. Thank you.
That was wonderful. Thank you so much for taking us through that. I see we already have a question in the chat, so maybe I'll just start it off with that question. So Lori says this is really wonderful work, and she's wondering about future adaptations. Do you have plans to translate it? Can it easily be adapted to other cancer survivors, like maybe gynecologic cancer?
Thank you, Catherine, and thank you, Laurie. Yes, I agree that there is future applicability and replicability and adaptation of this based on the Creative Commons licensure. And it's important to disseminate this key research findings and promote the work here into other cancers too, cancer survivorship, supportive care, transitions in cares, using digital health navigators and digital health tools, example like gynecological cancer. And some of the thoughts arise with recommendations that sharing a common platform and with some of the common cancers, also with the kind of a collective actions that take place during the time they need to navigate in their journey, and the kind of comfort they feel when initiating dialogues with voicing their concerns with healthcare professionals or with people on their journey, especially the key messages about their own care and their preference and what they need. I think it's always worthwhile to share these ideas with people when they come across with healthcare professionals or people they discuss about their care plan. And sometimes it's always a part of their care plan when the time they are diagnosed with the cancer, example like gynecological cancer, and then they are in that survivorship plan from the day one, they're screened and diagnosed. And sometimes it's about who's to bring up that conversation when they have multiple um, healthcare practitioners working with them, and just sharing that thought and keeping it open to bring it across to their own healthcare professional teams at the same time when they are connecting with the person who is coming for treatment may not necessarily open up those dialogues. Thank you, Laurie.
And just on the topic of translation, is there any plans to have some of the content translated for folks that may need that?
Yes, the study is still ongoing in this final stage, and there is monies for translation and adaptation of this material into different common languages used in British Columbia.
Amazing. Anybody else with questions? You can feel free to raise your hand or unmute yourself, or if you want to pop it in the chat, I'm very happy to read it out. Maybe while we're waiting for people to think of a question, I was wondering a little bit about getting a little bit more detail about some of your knowledge translation planned activities. Is this something is the use of these types of tools something you're planning on advertising to the patient population, or is it more centered around provider education?
Yes, Catherine, thank you very much. We had one integrated knowledge translation summit last year in February 2024, and that included the voice of different stakeholders, healthcare professionals, people affected with the cancer, breast cancer, and other cancers, and caregivers in Kamloops at Thompson River University. And it was shared with international and other provinces and in British Columbia. The main idea of that was to look at what are the priorities for people when they want to voice out communication languages with their healthcare professionals, and what are importance to them in what they're seeking from healthcare professional practitioners. And we have a set of importance that came up, and the most important that came was people talking about living and thriving with their breast cancer and what it means to them, and their voice being heard in their communication with their healthcare professionals, and bringing out questions or even being asked questions that is important to them in their journey based on their social, economic, and their race and their needs for translation in that journey. The second that came up was just talking to them about what it means to be metastatic. What is the meaning of that? What is the meaning of palliative? and just explaining that more simplified way compared to accessing them on different resources and understanding what it means when you look at treatment options and we talk about this is metastasis or this is advanced or this is now palliative or end of life, and just having that meaningful and significance what it means to them and their caregiver and the family, and how easy that journey would be for them and the comfort of them talking to the related people in the journey. I think those two priorities. And the other one was creating a center. That was one of the important things that came up here, a hub or a center for cancer supportive and survivorship needs for the people, where they can have different people with different cancers coming to that center, where they will have access to different medical, legal, social, spiritual, their navigation, networking with different health professionals, peer groups, and professionally led mentors and coaches. I think those were the three that came up. And we are having ongoing um, knowledge translation, which will take place now in the next year with the people and the stakeholders. And we had one community engagement this year in March with people who had breast cancer. And that was mostly to validate some of our findings and what are next steps in the collective action plan to take with key messages from people affected with breast cancer to senior leadership positions and recommendations. So there's more comfort in initiating dialogues.
Wow, that's amazing work. Very comprehensive. So I see another question has popped up here. Nicole's asking, I'm curious about your experience using the CFIR. I've heard it's a complex framework from a researcher slash user perspective.
Thank you, Nicole. Yes, the consolidated framework implementation research is complex, but there are different parts of the domains of that which we identified for our study, and I explained those three themes. So one of the things what we looked at that was the outer setting, inner setting, and the interventions need into consideration who is our participant, their needs and preferences, and how do we tailor our digital health innovations according to that, and the resources and example like survivorship with breast cancer, and who is heavily invested in creating that culturally linguistic tailored resources to support and educate them managing their symptoms or fulfill their information needs. And that's why maybe one of the question was, are you going to translate all these information you got for these participants for different cancers? Is it applicable? So stakeholders who are part of this survivorship or supportive care are looking example like support groups, how they tailored, and that was one part of it. The second was the need for these resources within healthcare professionals, within healthcare practitioners, and focusing on that in the setting where they are in the practice settings, whether it be a home or rehabilitation, community or acute care or in the BC Cancer Clinic, and the effectiveness of that active cancer treatment that they are facing the patient and the effect on their own supportive care and survivorship along that. So different stakeholders are involved in that, in the delivery of that, in the treatment aspect or in that settings. At the same time, there is that proactiveness of the patient involved in his care, example, like financial insurance or reference to community resources or who is involved in that active cancer treatment and the need for dedicated people in that and providing that. That was the second important for us to look at. And the third was the access to electronic medical records for the person and for healthcare professionals who are taking care of that one person. So what are the barriers that can be reduced in overall survivorship care planning when you look at survivorship care plans or treatment summaries that people go away with from their doctors or from their oncologist, and the language that needs to be translated for them from English to other languages while they're taking those paper or online formats, and who is accessing them, and what does that diagnosis mean to a person in his treatment when he's coming back for recurrence of cancer or coming back for treatments uh, X number of times, and how that is translated across and coordinated and between the healthcare professionals. And that's what we looked at, these three important parts when we made into the consolidated framework of implementation. But it is doable, and those checklists in CFR can be tailored to the context of the community that we are working with, and also can be tailored to the populations that we work with. Example, in ours, it was the Indigenous, Black, Asian, minority, and Caucasian. So tailored to that. And I think it's a mixed view of how we want to use it based in the context. Is it trauma-informed, compassionate, empathy, or it's an evolving process? We are using the consolidated framework, and they have choices in implementation research. We are going by theory, practice, or implementation research for practice or theory alone, and what was the end outcome we are serving in that.
Excellent. I have another question. Oh, and maybe I'll just follow up with Nicole's for a second. It's helpful to hear the intentional application of the domains and how you've incorporated justice-oriented approaches. Yeah, excellent. Thank you, Nicole. Another question here, just making a comment that the research is so impactful. Do you have any thoughts on having a knowledge hub on this, which will be a one-stop shop for breast cancer patients? I think you alluded to this a little bit already, and I guess my maybe follow-up question to that would be, is this hub an online digital location as opposed to a physical location?
Currently, based from these findings that we got from the CHA Planning and Dissemination in the Breast Cancer Canada, this is a cancer innovation lab that was created digitally, and the workspace with the clients and the participants were in an online digital platform. Subsequent to that, we received another internal research funding that is involved with integrated community navigation supports in the community and resources. And we are hoping that this grant will help to create a center here in the interior region, more in person, and where people with breast cancer would be able to access the resources in community for professional navigation, supportive, and survivorship care. Thank you for the question, Dr. Bharat.
Yeah, excellent question. Any other questions from the audience? Please feel free. You can just raise your hand or unmute yourself or pop it in the chat. Did you notice any differences? Because I know that you were really intentional in including folks from different ethnic backgrounds. Was there any differences in how groups navigated the content or what they liked best about the experience? Or was it kind of a unified finding?
Yeah, I thank you very much, Catherine. I also see Nicole mentioned that how was the about the aspects of justice-oriented approaches. So one of the aspects that we included in this was the feasibility of this design, acceptability, and use and satisfaction. So in the beginning, in the community participatory action, we had built these community partnerships and collaborations with the community in the recent 8 years in the community and interior region. So through the community advisory board, we had connected and have people on board from different intersectionalities or groups experiencing from a patient to a healthcare provider, a practitioner, or a caregiver to be part of this. So one of the challenge that we faced was with the context of example, with being a person who is Black, with trauma, a person who is having the language or access to travel or accommodation. One of that was a challenge situation. The second was about the satisfaction with regard to the number of interactions that we had with them in a confidential or private online atmosphere. And most of the things that the responses of the people was mixed, that they preferred to have had this interaction both in person and online compared to only having online sessions with the professional navigators. So communities or people who mentioned this was one of the aspect of having older people, aging people, and having to have some of them in person to be able to understand and connect. And that worked for them. Like example, one of the question was, am I doing enough of what is expected of me to keep away the cancer? Or one of the positive is like, what helped me in this journey, putting me in the right direction with professional navigators, and what I deserve to have in what I'm expecting from this program in my life and what's beneficial to me. And my context that I have. Those were some of the questions that came up from the participants. And it was not very easy to look at the navigation activities when we have, because one of the things that sometimes it can be overwhelming to a person in the illness of the cancer that they have been diagnosed with, or the seriousness or the severity it is they are diagnosed with. So working with, example, a participant who was in an older group, and honoring what they making the decisions for themselves. At the same time, also navigating that journey has to how to help and support them with the online access to resources. So there was some promise of showing some quality of life for the person who was maybe having an elderly person with the cancer, and the meaningful role the professional navigator played with them in the diverse communities that they live with. And that's why we mentioned one of the impact was focusing on people with aging, rural, with the diverse ethnicities, and scaling it up according to innovations. So the good thing a little bit about the project, I could say the navigation survivorship, was adapting the context to the person that they connected with. So it was all about the person. So they had the navigation had action plans, commitments. They had effort times that they worked with them. Example, one of the thing would be, are you frustrated coming, or is it more than usual that you spend yourself coming to these sessions? Are you concerned about something that's very specific, maybe out of pocket expenses? Or was there, do you think that there was sufficient satisfaction for you to come to the next session? So these were things that were on their form in the bi-weekly session, where they are able to look at and help and support the person, um, the participant in this project.
Oh, that's great. That really paints a picture. Any other questions? Okay, well, if there's no other questions, then I would just really like to thank Dr. D'Souza and Ishwarya for joining us today and telling us about this amazing project. And we would love to hear about next steps or next phases as they come up in the future. So please reach out to us as this research progresses, as I'm sure it will. Amazing work. And would just like to thank you for this great talk.
Thank you very much, Catherine, and thank you everyone for listening to us. Thank you, Aishwarya, for being here.
Thank you,
Thank
Ashwarya.
you.
Appreciate
Thank
it.
you. Thank you so much, everyone.
All right, everybody. Well, I wish everybody a very happy weekend and still raining, but that's okay. We need it. Have a great weekend, everybody.